This is Salam Media, and you are tuned into the Miriam Makunda Show.
You are listening to the Mariam Mukonda Show on Salam Media. It is 12:35 on this Tuesday. I am your host, Mariam Mukonda. On our Women's Health Tuesdays today, we are going to be talking about toxic shock syndrome, a rare, life-threatening complication of a certain bacterial infections. Here to tell us more is our OBGYN, Dr. Tom Mokaya. Good day, Dr. Tom.
Hi, good day, and good day to your listeners, and thanks for having me.
Thank you for joining me today. So, Dr. Tom, what is toxic shock syndrome?
Now, toxic shock syndrome is, to define it briefly, is a syndrome which occurs when toxic substances enter into the bloodstream of somebody, and then they cause very many changes in the body. Now, and most of the time, to just give you a quick overview before we continue, most of the time is observed in somebody who, let's say, has a tampon, and most of the time it's what we call a super absorbable tampons. And what normally happens is that those super absorbable tampons, we think that they may cause some abrasions and some toxic substance enters into the body. And once it enters into the body, it causes very many changes. It causes a toxic problem, and the body gets shocked. Now, the shock that most people know is you are given some information which you don't like or you're surprised, then you get shocked. But in medical terms, when we say that somebody is in shock, it means that the body systems can stop working or the malfunction. Let's say, for example, the blood pressure drops, the lungs stop working perfectly okay, the kidneys get affected. That is a medical condition which we call shock. And then it's a syndrome. A syndrome is a group of signs and symptoms. So toxic shock syndrome is where a toxin enters into the body and causes a medical shock, and there's a syndrome. So there are many things that do occur that are associated with the syndrome.
Now, since it is a rare infection, what are the most common symptoms?
And now, it's true, as you say, it's actually very, very rare. And most of the time, it's associated with, let's say, an abrasion or a cut in the body's covering. Most of the time, we think that it's associated with tampons, which are super absorbable, which are super absorbent, and they cause little lacerations on the vaginal wall. And because of that, some toxins enter into the body. And once they enter into the body, they cause that syndrome, and it can occur very quickly. So, of course, it will be associated with somebody who's having a period, because that is why one will wear a super absorbable tampon. And once that happens, one will experience what we call as a triad, three main things. There will be a fever, they might experience vomiting, and they might experience diarrhea. So those are the three things that one may experience, and that may take them to hospital. And once they go there, we find that there's a fever, they might be associated with abdominal pain, and once they're admitted, we may find that the blood pressure has dropped, etc., etc. So the main symptoms is diarrhea, fever, and it's associated with skin manifestations. They might get a rash all over the body, or in some parts of the body, or they might get a rash in the eyes, etc., etc.
Now, Dr. Tom, you mentioned that the toxic shock syndrome is mostly associated with women who use tampons during their menstruation. But can someone get TSS without a tampon, or perhaps using a pad or something else?
Yes, one can get TSS without necessarily using a pad. Now, if the reason why we think it's associated with a super absorbable tampon is that we think there's a small laceration which occurs, and then those bacteria or those toxins enter into the body. So if, for example, somebody has an abrasion, somebody is accidentally cut on the skin for whatever reason, and then those toxins enter into the body, one can also get toxic shock syndrome. And it may also associated with even a burn. If somebody gets burnt somewhere, and then those toxins, which are produced by mainly two forms of bacteria, which we call staphylococcus and streptococcus. So any place which is open and then those toxins can be able to enter in can also cause toxic shock syndrome.
Wow. And how is it diagnosed?
Now, the diagnosis most of the time is met by the symptoms that the patient will present with. Of course, she'll give a history of menstruation and having a tampon. So once she gets into the hospital, there will be a high suspicion because she's menstruating and she has a tampon. And then we will do all the necessary checks that we do. We'll check the blood pressure. We'll find that most of the time is low. On the skin, we'll find that she's got a rash. And then we'll do laboratory studies. Now, the laboratory studies are to check for that bacteria. So we get the blood, and we go and culture it. So there's a blood culture, and then we also check for other systems which are affected. We check for the kidneys and the liver. So we do a lot of blood tests to make that diagnosis.
And the treatment?
Now, once the diagnosis is made, the treatment has to be very swift and very quick, because for some reason, things change very quickly. So because the blood pressure has dropped, we need to give a lot of fluids. So we give a lot of, it has to be what we call as a peripheral line. We put a line, we give these patients a lot of fluid through the vein and not through drinking. Sometimes they may not be able to drink because they are physically shocked. So we control the blood pressure. We increase the amount of fluid they have in the body, take up the blood pressure. And at times they tend to bleed a lot and they lose blood. So if necessary, we give them more blood. And in instances where we find that obviously it's caused by an infection, so you have to be given antibiotics as soon as possible, which cover all possible bacteria that may be associated with TSS. And with this, something we call supportive treatment. So we have to make sure that all the other organs are also working well. And there are instances where we find that these patients go into shock completely. They can't even be able to breathe. So the management of a patient like that is in ICU. So they are taken to ICU, and all those tubes that we see on movies are inserted so that we can be able to control their breathing.
Now, since it is rare and life-threatening, have there been any advances in medicine for it to be at least understandable and also for us to prevent it?
Now, according to studies that we have, we know that around 3%, 3 to 6% of the times it can recur. So if one has had it, the best thing to do is never to use a tampon again. Or if one is going to use a tampon, we need to make sure that we do cultures in the vagina, where we take a swab from the vagina and look to find out whether they have that bacteria. We call them staph and strep, to make sure that they don't have the staphylococcus and the streptococcus. So that has to be done, and we make sure that they are free of those bacteria for at least 4 weeks before we can allow them to use the tampon again. So those are some of the advances that have been made. And of course, in the industry of making tampons, they have also tried to move away from those kind of tampons which have been associated with the TSS. So those are some of the advances that have been made. And of course, just like what we're having right now, it is
Mm.
important that the public is aware of what is happening. And therefore, if they know that somebody has had them before, they discourage them from using the tampons.
Mm-hmm. And are there any home remedies, or rather what we can do to prevent getting TSS?
Unfortunately, TSS is a very complicated and very rare, very rare syndrome. And therefore, they are not really, there's nothing really one can be able to do apart from the normal hygiene of trying to make sure that one uses properly fitting tampons and they keep their vaginal area clean. So essentially, it's just basic hygiene that we encourage one to have.
Well, very interesting discussion. I actually wanted to have this discussion because I came across an article by a lady who said that she got TSS, but it was not caused by a tampon. But I'm glad, Dr. Tom, you were able to come and clear that out for us today and also explain to us in detail what TSS is. Thank you so much for your time once again.
Thank you. Thank you so much for having me.
It's a pleasure. Have a wonderful day. Bye-bye.
You too. Bye.
That was Dr. Tom Mokaya, OBGYN, taking us through toxic shock syndrome. As you've heard from Dr. Tom, a rare disease caused by streptococcus and strep. What does he say? What did he say? Strep and strep. Something like that. You know, these are all confusing, long medical terms. But yeah, they are caused by those two bacteria. And if you have an abrasion, if you have a cut, even a burn, and some chemicals, these bacteria enter through your skin, you could get toxic shock syndrome. So, guys, unfortunately, I can't tell you to be aware, but it is what it is. You know, as the medical field and medicines advance, so too will diseases such as TSS become more common and easier to treat, and hopefully it doesn't have to be a rare life-threatening disease. If you have any comments, please leave them in the comment section as well as your questions, or you can send them to WhatsApp on 061 766 0355. We will be right back.